Hi guys, let's welcome medical coding. Now we are discussing about diabetes mellitus questions. First one. A provider documents seeing an initial encounter for a patient that has type 2 insulin resistant diabetes due to accidental exposure to nitrogen oxide. He now administers insulin once per day. Check it here. Nitrogen oxide. It's a drug. So its code is E09 series because E08 is underlying diseases, E09 is drugs related diabetes, E10 is type 1 diabetes, E11 is type 2 diabetes mellitus. So here A option is wrong, C option is also wrong. Remember one thing, most of the cases complication codes will become primary codes in ICD. 90% of complication codes are primary codes. So check B and D. Here B, accidental poison, accidental toxic effect it is, but D is intentional, so B option is right. Coming to next question. Type 1 diabetes patient is brought to ER by ambulance in a coma. The patient is pale, rapid heartbeat and their face is covered in sweat. Physician finds the insulin pump not delivering insulin and after reviewing the labs diagnoses the patient with diabetic ketoacidosis with diabetic coma. Here whenever we are coding, please check in coding guideline, chapter wise coding guideline. They clearly mentioned overdosing and underdosing. Here underdosing question, here clearly mentioned and insulin is underdosing. I told you first question, right? Most of the cases complication codes are primary codes. So here cancel C and D, compare A and B. T85.614A, it's a breakdown of insulin pump. Next T38.3X 6A, underdosing of insulin and oral hypoglycemic anti-diabetic drug. A and B same two codes. Next C, E10.10, E10.11. E10.10 is without coma, diabetic ketoacidosis with diabetic coma here mentioned. So cancel A, B option is right. Here mentioned ketoacidosis with diabetic coma. So B option is right. Coming to next question. A 45 years old diabetic patient returns to his physician office for a 3 months follow-up visit. The patient has no complaints. After an expanded problems focused history and physician examination, the physician documents in the medical record diabetes well controlled with Lantus diet and exercise. Patient will continue with same medication dosage, monitor glucose levels with home monitoring system and returns in 3 months for recheck. Here whenever he didn't mention type 1 or type 2, default 11 type 2 code. So cancel B and C codes, compare A and D. In A only E11.9 is mentioned, in D E11.9 comma Z79.4. I tell you one thing, wherever in diabetes codes, if in case Z79.4 is not mentioned at the time, what will happen is, I will tell you one thing, wherever type 1 diabetes we don't code Z79.4. whenever gestation period we don't code Z79.4. whenever the insulin is temporary means at the time don't code Z79.4. Here this all not is not there, so D option is right. I hope you understand.